American women make most of the healthcare decisions for their families, but often delay their own care as they try to balance family and work. But advances in gynecological surgery are giving women more options, including less time in the hospital and a quicker return to everyday activities. Doug Johnson looks at how that helps them stay well beyond a diagnosis.
Angeline Calvert told her cardiologist about symptoms she thought were being caused by some of her medications. He sent her to see her gynecologist.
And with the test that they did, they determined that I had uterine cancer. It was endometrial. So they sent me here to Dr. Kumar.
After the diagnosis, they determined together what the next step should be.
So I've gone through a radical hysterectomy and radiation, and I'm in the process of the chemo now.
Dr. Kumar at BMG Surgical Oncology says Calvert was able to benefit from a less invasive type of surgery to remove her uterus. An option, he says, is available to many women.
The surgery for cancer has evolved quite a bit. So much so that a lot of minimally invasive options are now available to women with cancer.
Another patient, Debbie Franks, first dealt with cancer 25 years ago and thought her symptoms were something else before learning she had ovarian cancer and needed a hysterectomy as well. She appreciated the idea of a surgery that would remove the cancer in a less invasive way.
My expectation is get in there, get it out. The longer I wait, the more it's growing. So for me, the sooner the better. Get in there and get it out.
Less invasive methods include endoscopic, laparoscopic, and robotic surgery, which allow doctors access through very small openings in the body to repair damage inside the body. Another method, hysteroscopy, requires no incisions at all. Those types of procedures have a number of postoperative benefits, including less scarring or other trauma to the body.
Tremendous benefits, several times reduced risk of infection after the operation, virtually non-existent DVT after the operation, which is a big problem with traditional open surgery, much less pain, much earlier return to work, things like that.
The advances in gynecologic surgery also provide benefits for women who have problems other than cancer, according to Ahmad Azari, one of the other doctors in the practice.
Traditionally, the surgery was used to be called as just open the surgery, like up and down or low transfers, a skin incision, or provide whatever is the goal of the surgery. In field of the gynecology, for example, for hysterectomy, one of the most common surgery. So in that traditional way, patient usually stay in the hospital 2 or 3 days, and the recovery is about 6 weeks.
So, for fibroids patient LaMonica Clark, who didn't want open surgery, there was a minimally invasive procedure similar to what she had had for a previous operation.
So when Dr. Azari and I were speaking, I had advised him that I had tubulization, had my tubes tied. And he said, well, that's the same way I would go in and do your surgery.
And the shorter, less painful recovery process is something that can be a pleasant surprise for patients.
Didn't have a lot of pain. I was on pain pills for maybe 2 or 3 days, and then I started with Tylenol and Advil, and that was the extent of what I was taking during that time.
These less invasive approaches have helped millions of patients spend less time in hospitals and enjoy quicker recoveries. For Smart Medicine, I'm Doug Johnson.